In this episode of the ASC Podcast with John Goehle, we cover the latest updates from the ASC industry, review recent developments with CONs, discuss the anesthesia model, and the OIG, provide an update on the Corporate Transparency Act, and in our focus segment, we discuss emergency preparedness.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, RFX Solutions, your all-in-one healthcare regulatory compliance software, MedServe, which is the only digital narcotic cabinet specifically designed and priced for surgery centers, helping standardize processes, compliance, eliminate paper logs and prevent drug diversion, and Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 240 of the ASC Podcast with John Goehle, recorded on March 11th, 2025, from our studios in Spencerport, New York. I'm Sue Cronkite, your co-host and operations manager at Ambulatory Healthcare Strategies. As a reminder, the regulatory landscape for ASCs is constantly changing. The content in this episode reflects the most current information available at the time of recording. We encourage all ASCs to remain vigilant and keep up with any updates or new guidelines released by relevant regulatory authorities. Joining me today is John Goehle, the owner of Ambulatory Healthcare Strategies and one of the leading experts in the ambulatory surgery field. With over 3 decades of experience, John has authored more than 10 books on the ASC industry, and he is a highly regarded speaker on topics related to regulation, accreditation, and finance management.
You know, Sue, whenever I hear you say 3 decades of experience, I start to feel very old. But then again, the fact that my children are no longer in their 20s and are well into their 30s now is helping to it's a bit of a reality check. So,
and that your grandfather.
Yeah, right. I mean,
it keeps adding up. So.
It does.
But I know 30 years doesn't sound as bad as 3 decades.
Yeah, that's
for
right.
Some reason.
Yeah, thanks a lot. Well, we have a lot of excitement going on here. Rosie, our mascot for both Ambulatory Healthcare Strategies and, of course, the podcast. She's our English Cream Golden Retriever. She had 9 puppies on Super Bowl Sunday.
Yes.
While the Super Bowl was going on, we were delivering these 9 beautiful puppies here. So they are keeping us very busy, and they are super cute. So
just over a month old now.
That's
and we're
right.
starting to feed them now actual food, all mushed up with water. So, you know, they jump in the bowl and they roll in the bowl.
It's a little messy.
So it's kind of a messy place around here right now.
So during your busy days, if you want a little bit of fun as you're trying to navigate the ASC world, feel free to visit Fox Meadow English Cream Goldens on Facebook. That is, if your employer has not blocked Facebook on your computers. Our weekly drop-in sessions are continuing. This is a great benefit for our patron members, and what you can do is you can connect. Usually it's on Saturday mornings, but we are going to be moving it around a bit to put it on Mondays and Fridays, depending upon our schedule. But it's a great opportunity to connect with the podcast hosts and other patron members. And another benefit right now is that we have been showing the puppies every Saturday. Yep. So that's been fun for everybody to see that.
And there's always at least 3 surveyors on there. Sometimes our life safety expert, who is a surveyor, also pops on. So it's a great place to get your questions answered.
Yeah, and it's a lot of fun too. I mean, it's almost like therapy, I think, for many. We're always talking about past surveys, recent experiences, and people are always asking great questions during this. I really enjoy that time on Saturday morning. So as I said, we're going to be moving that around. So if you're a patron member, definitely go to ASCPodcast.com and follow the prompts for the Patron Program. I do want to call out all of our wonderful sponsors here at the ASC Podcast: Surgical Information Systems, RFX Solutions, MedServe, and of course, Ambulatory Healthcare Strategies. We are very grateful for their support of our program. And they all have been so busy, Sue, that we really have had a hard time getting them to do some special episodes or special interviews. So we're working on that right now. But the good news is all four of those organizations are very busy. And to that end, Ambulatory Healthcare Strategies continues to expand. So it's been a while since we've been looking for new people to join our team. So if you have an interest in quality improvement and risk management and are passionate about helping ambulatory surgery centers, we'd love to hear from you. So if you're interested or would like to send us a resume, feel free to send it to info@ascpodcast.com. We have different types of opportunities available at any given time. We don't have any specific jobs right now, but we are expanding and we're always looking for people.
And of course, some of our centers might be looking for people. There's, a lot of turnover right now in the industry, and there's a lot of people out there looking. So, anytime if you're looking for a new opportunity, we can probably help you out in some way.
That's right. Sue, it's every day we get email messages or phone calls, people looking for administrators and directors of nursing. And, we have our very well-known boot camps, which help people, get more experience in as a director of nursing, as an administrator. So if you are interested in those programs, by the way, visit ASC-Central.com. And so I think one of the benefits of, keeping up with what's going on by listening to the podcast really makes you great candidates for some of these positions. Yeah. And I hope that, over the 200 some odd episodes, I forget the exact number, 240 episodes, you've learned a lot. We are going to try to increase the number of episodes that we're doing. We've been kind of slowing down a little bit because we've been so busy and because we're constantly looking for DONs and for administrators. But definitely there's a huge need out there. And if you're, not yet an administrator or director of nursing, reach out to us because there's some great opportunities to learn more about that. The educational programs that we sponsor at ASC-Central, as well as the podcast itself. So, I think, Sue, our audience is starting to understand the desperation that some of our centers have right now. They've asked us to get the word out there because there is just such a huge demand right now for leaders in the ASC industry.
Yeah, and like you said, just the fact that everybody out there, that you're taking the time to listen to something to try to educate yourself, that says a lot about you as a candidate already.
So, Sue, there always seems to be a special week in the ASC industry. So what is the special week this week?
This week is Patient Safety Awareness Week. So the IHI, or the Institute for Healthcare Improvement, they're kind of the, founder of that. And they've got some ideas on their website, like I said, the Institute for Healthcare Improvement, for celebrating and promoting patient safety. And they're also presenting a webinar on AI implications for clinicians and patients, which I think I'm going to watch. That sounds like could be interesting. But, a lot of different ideas of that different centers have done to kind of draw attention to what they can do to keep patient safety foremost in their care.
Yeah, and Sue, it's interesting to bring up AI. It's one of those areas we are looking to do a podcast in the near term on artificial intelligence and different applications of it in your surgery center. We have found it very useful, somewhat dangerous because, some of the information you get from some of the AI answers are incorrect or, misleading. But it definitely is something we have to keep our eye on in the industry because there's wide ramifications for it, both from a clinical standpoint, from an administrative standpoint, from research. I think I'm excited about its opportunities, but I'm also scared, for the misuse or, the reliance, too much of a reliance on AI.
Yeah, and privacy issues, HIPAA, all those kinds of things.
So let's talk about some recent news. Sue, I saw in a recent article, kind of a follow-up on Certificate of Need reform. So just a little bit of background. CON, or Certificate of Need regulations, date back to the 60s when there were concerns about increasing healthcare costs and the impact on competition and the duplication of services in the healthcare industry. They have been a big part of the ASC landscape from the beginning of the ASC industry. And actually, I served on one of the organizations that reviewed certificates of need back in the 90s when I first got into the industry. It was a fascinating time. But it was a very costly process, and it continues today, though there has been some changes. And one big takeaway I have for those of you listeners who are looking to start a surgery center, remember that CONs are required in some states, but not all states. And in those states that do require you to have a certificate of need, you're going to need to apply to build a center. So make sure you know what your state requirements are. And they can be quite daunting depending upon your state.
Are they needed for other things, like if you're expanding your services or adding on?
Yeah, actually, thank you for bringing that up. It's I kind of forget about that. And again, it depends upon the state you're in. Yeah. In some states, you might have to apply for a CON in order to add additional services, or to move from a single specialty to a multi-specialty. And by the way, that's been happening quite a bit. We've been Ambulatory Healthcare Strategies does CONs especially in New York, in some other states too, but especially in New York, and that has been a big recent development where the number of applications for going from single to multi has definitely increased. Now, the law firm of Whiteford, Taylor, and Preston, LLP, and I'm going to provide a link to them, they recently published an article on their website in February that discussed trends and certificate of needs throughout the country. And I thought it might be interesting to kind of just run through some recent developments. So in recent years, substantial changes in CON laws have been seen across several states, impacting the development and expansions of ambulatory surgery centers. For example, in North Carolina, they are eliminating the certificate of need requirement for ASCs in counties with populations exceeding 125,000 people. And that's going to be in effect by November of 2025. That was kind of an interesting development. I've never seen a restriction based upon the population in an area, so that's an interesting development there. South Carolina has actually repealed its CON laws for ASCs but keep in mind, licensure requirements certainly still do remain. Tennessee will lift its CON requirement for ASCs by December of 2027. And then following the repeal of these CON restrictions, ASCs that are not affiliated with hospitals will be required to participate in TennCare, which is their Medicaid program in Tennessee. And they're going to have to provide a comparable amount of care to TennCare enrollees and charity care as similarly situated hospital-based ASCs. And that is one of the developments I've seen with certificate of needs, is really a way of trying to pressure providers to make sure that they're participating in the Medicaid programs in the state or to provide charity care. And in addition, in Tennessee, the Health Facilities Commission is tasked with creating a plan to study the impact of that CON reform and facilities licensure in the healthcare industry for at least 6 years, and the results of which will be used, likely is going to be used to influence future regulations in the state. And Georgia has introduced exemptions for single specialty ASCs owned by individual physicians or practices, provided they meet specific criteria. And again, I'll provide a link to this particular article at the Whiteford, Taylor, and Preston website. And Sue, as we all know, anesthesia is a hot topic right now. Yeah. A lot of issues with anesthesia. We are trying to put together another episode where we'll talk about anesthesia in the near term. But right now, I just want to talk a little bit about a recent Office of the Inspector General, or the OIG, advisory related to anesthesia and specifically to some of the arrangements that are going on out there. So in that same article that we referred to earlier from Whiteford, Taylor, and Preston, there was a discussion of recent OIG challenges to the anesthesia company model. Now, this is a very complicated area, and our purpose here is just to help you recognize where you really need to get a lawyer involved in this. Certainly, we're not lawyers here, and we can't help you to determine whether your particular situation is appropriate. But let's just kind of point out some information from this recent OIG advisory. And of course, just a little bit of background. We are experiencing considerable changes in the provision of anesthesia services in ambulatory surgery centers, which is related to the anesthesia provider shortage. And by the way, from every conversation I have with anesthesiologists and with the industry, it does not appear that there's any relief in sight in this anesthesia crisis. So as a result, ASCs are looking for innovative arrangements, and they're engaging in complex negotiations with their anesthesia provider. One solution that many ASCs have used is the company model for anesthesia in the ASC. Now, Whiteford in their article explains that the company model has largely been determined by OIG to violate the anti-kickback statute, which, by the way, Sue, I was very surprised at. I don't keep up on this so much. I leave this to the lawyers, but it was interesting given the number of organizations that are looking into the company model. So this model involves surgeon owners of an ambulatory surgery center forming an anesthesia services company to provide all of the anesthesia services for the center, with the anesthesiologist and the CRNAs being employed or subcontracted by that company. And then a significant share of the anesthesia fee will be retained by the anesthesia company surgeon owners. Alternatively, the ASC itself directly employs the anesthesia providers or controls the company that employs the anesthesia provider and treats the anesthesia fee the same. In other words, retaining a portion for the surgeon investor. So the OIG has issued an advisory opinion in early 2025 that called out the company model situations as possible violations of the anti-kickback statute. And noncompliance risks penalties of up to $25,000 per instance, with possible civil and criminal exposure under the Department of Justice oversight. For ASCs employing this model, make sure you discuss your particular situation with your attorney. So again, I'm just calling out that this is something you definitely need to not only consult with attorneys, but even if you've already had an attorney look at your model, have them keep you up to date with regard to any developments in this area. So when considering the company model for anesthesia, ASCs must engage legal counsel that is familiar with compliance issues related to the anti-kickback statute and the OIG guidance, as well as documenting and practicing the elements of an intended safe harbor. And again, I'll provide a link. And again, it's going to be the same link to that previous Whiteford Law article. Sue, we have been talking about the CTA every episode since last year.
Back and forth.
So can you give us an update? By the way, we probably should say as of March 11th, just in case it changes after this episode is published. Go ahead.
So there was a Garfunkel Wild alert at the beginning of March that the CTA reporting requirements were partially suspended. So the U.S. Treasury Department's Financial Crimes Enforcement Network, or FinCEN, announced on March 2nd that they will not enforce the BOI or the beneficial ownership information reporting requirements, which is where businesses have to report their owners' information and
correct. And they have to go to a website, enter this information, especially I think it's for
personal information.
Yeah, for owners over 25%. And of course, if you've been listening to the podcast, as many of you do, we've been going back and forth on this. But Sue, as you indicated, this is confusing. It's a little confusing as the requirement is still in effect, but there will be no penalty for failure to file.
Yep, they're not going to enforce it right now.
Right.
And what they're looking at is changing the requirements to apply only to foreign reporting companies. So domestic companies hopefully won't have to do this, and it'll hopefully be settled once and for all when they actually come to an agreement. And I'm sure that we will be reporting more on this.
That's right. It seems like a regular section in our podcast here. You can still report to this, to the FinCEN website. I personally would not recommend it. I mean, you're providing a lot of personal information to the government, which I'm not sure is really necessary. And again, the reason we bring this up is because ambulatory surgery centers, most of whom are LLCs or limited liability companies, do fall into this category of being reported. And the reason that the Treasury Department has put this on hold as opposed to stopping it is that it was required by Congress. So I do believe it requires congressional action in order to remove it, which, of course, will take some time.
Yeah. And in the Gallup workplace, there was an article from on February 24th that people looking for new job opportunities is at the highest rate since 2015. They're calling this the Great Detachment because so many employees feel disconnected from their employers. So it's even more important to know how to keep your employees happy and to build loyalty in your center. I mean, years and years ago, people stayed with their employer for their whole lives.
Right.
And then, of course, that's kind of changed, and the way to move up often is to move from place to place. But yes, it's just gotten to be really at a high rate right now. People don't really feel a lot of loyalty, and they're just not really happy. So they conducted a study of more than 10,000 employees from all areas. This isn't just healthcare. And they came up with the most important factors that they're looking for in a job. And these are work-life balance and personal well-being, pay your benefits, of course, stability and job security, and a job that allows me to do what I do best was one of the categories. And I looked at a few of the Gallup polls. There's actually an interesting website. A lot of the companies believe that they're good at making their employees feel valued, but according to another Gallup survey that I saw, only 1 in 5 employees believe their company cares about their well-being. So there's that huge disconnect there. So I think trying to come up with creative ways to help your employees feel not just valued, but like they're really able to do their best at what they're trying to do, that they're heard, that they're feeling kind of fulfilled, and that you care about their work-life balance. It was also broken down by generations,
right?
Gen Z and millennials and that kind of thing. But it is becoming more and more important, the work-life balance.
Yeah, it's interesting. That's the big takeaway I had with that, and that's one thing I'm seeing with the centers, at Ambulatory Healthcare Strategies, the centers that we work with, is that is a frequent issue that we hear when we're talking to administrators and directors of nursing. That sometimes they leave because they're looking for an opportunity that helps them to balance their life. Be it finding a center that's closer to their home, so they don't spend so much time commuting. Finding a center that allows them to work around their personal schedule, their children's schedule. And I think that work-life balance is becoming even more important today than perhaps it has been in the past. So definitely find ways to work with your employees to make sure that work-life balance requirement or that need that they have continues to improve.
Yeah, I think if they feel like they've got something special with your company, it does, even if there's times they go through that's really hectic, that they're feeling a little overwhelmed or stressed, they're going to stick it out.
Yeah.
And I think especially with nurses, that last one, a job that allows me to do what I do best.
Yeah.
Because really nurses or any healthcare provider, if they feel like they're not allowed to give the best care that they want to give, either because it's so busy or there's rules and regulations that people aren't letting them, and I don't mean the big rules and regulations,
right.
but in your company that, they're not allowed to kind of have a say in that. It's really stressful, and often that will cause people to leave if they just feel like, listen, I'm not, I'm working in an unsafe environment and I'm not giving my patients what I feel like I need to give them.
Right. Well, Sue, I was looking at our history of different conversation areas, and one thing that stood out is that we haven't talked about emergency preparedness in a lot of detail recently. So I thought that for our focus segment this week, we would go into emergency preparedness in ambulatory surgery centers with some updates on compliance and some practical implementation tips. So let's take a short break, and when we come back, we'll talk about emergency preparedness. It's been a long day, and the surveyor's just left, and you are exhausted. And looking at the list of items that you have to address, you wonder, how can I deal with this and still take care of my patients? More importantly, you wonder, how can I ever keep up with all of the regulations, standards, and accreditation requirements? How can I always be prepared for a survey and reduce my stress levels? Well, that's what Ambulatory Healthcare Strategies does, day in, day out. We become your outsourced regulatory and accreditation resource. We can maintain your policy manual, develop your education programs, help out with fire and disaster drills, do your risk assessments, oversee your quality improvement activities, help run your quality improvement meetings and governing body meetings, and we can even prepare your monthly or quarterly financial statements and help you figure out where you are financially. We are a retainer-based service. We don't take ownership. We don't charge based on your revenue. We have one fixed monthly fee, and we can tailor your services to your exact needs. So whether you're looking for help getting over a survey, preparing for a survey, or looking for a long-term relationship to assist you with your ongoing regulatory and/or financial needs, please give us a call at 585-594-1167 or email us at info@ahstrategies.com. That is info@ah-strategies.com, or visit our website at ah-strategies.com. So let's talk about emergency preparedness. So this is really a good time to bring up the subject as we are still in the first quarter of 2025. Sue, I'm hard to believe that we're almost to the end of the first quarter of 2025. And emergency preparedness is a real hot spot for CMS and accreditation surveys. Now, this just isn't about having a plan on a shelf. It's about being ready for anything from a blizzard to a cyber attack and proving that you're ready for those emergencies to the surveyors when they show up. So as we always try to do in our focus segments, let's start with the regulatory background, which comes from the Code of Federal Regulations. As we know, that's in Part 416. And the applicable area here is 416.54, the CMS Emergency Preparedness Rule. And by the way, this rule has been around since 2016. And we'll start with 416.54, the condition for coverage for emergency preparedness.
The Ambulatory Surgery Center must comply with all applicable federal, state, and local emergency preparedness requirements. The ASC must establish and maintain an emergency preparedness program that meets the requirements of this section. The emergency preparedness program must include, but not be limited to, the following elements. So the first one is emergency plan. The ASC must develop and maintain an emergency preparedness plan that must be reviewed and updated at least every 2 years. And the plan must do the following. 1, be based on and include a documented, facility-based, and community-based risk assessment utilizing an all-hazards approach.
So I want to stop here for a minute and just talk about what we really mean. So first of all, Sue, I don't think I've ever seen a good emergency preparedness plan that's been less than 50 pages. And I'll tell you, most of them are somewhere around 100 pages, to be honest, if you want to conclude all this information and make sure it's comprehensive. And as this section says, it has to be based upon a documented, facility-based, community-based risk assessment program using an all-hazard approach. So we're talking here about an HVA, or a hazard vulnerability analysis. And this is a risk assessment that you have to prepare every single year. Now, one of the challenges that I've seen, or one of the problems that I've seen when I review these as a surveyor, or even for some of our clients that are new to us, is that they copy and paste the previous HVA or the previous assessment, risk assessment, which is totally inappropriate because things are going to change every year. You're going to learn something new every year. And one of the elements of a hazard vulnerability analysis is assessing your preparedness for an emergency. So it'll talk about how are your policies and procedures? How frequently have you recently done drills in this area? So if you were to show that you have the same problems every single year, in other words, copying and pasting it, you're actually demonstrating that you're not actually implementing that program, that you're not following up on the risks that you've identified.
Yeah, because part of it is identifying what is a risk in your area. You know, some areas might be prone to floods, some areas might be prone to fires, or you're near train tracks, so there might be a train derailment. But the second part of, or, the way that you remedy that is, like you said, policies or, preparing, doing these drills. So you have to have that part has to change. And another thing, a lot of times people don't really use that risk assessment to create, to work on their policies, to work on their drills. And it's like a checklist, and people, they get so busy, they don't really put these two together. It's like, okay, I did the risk assessment. Okay, now we have to do the drills. But
there's no connection.
It's a tool to build the right drills so that you're actually, prepared for an emergency that could happen to you.
Yeah, and to that point, I remember doing a survey of an organization, and I looked at the HVA, and to my surprise and shock, they had identified explosion as the most...
So as you're running out the door.
Right. You were yes, I'm running out the door as a surveyor.
What's happening?
And I said, why did you determine... that an explosion was the highest risk that you have here, and I was very serious. I wasn't being sarcastic like I am prone to be, as you might note. But I really was wondering, do you have a bomb factory next door? Do you have fireworks, a company next door? Yeah, right, exactly. And they said, what are you talking about? And I said, well, look at your HVA here, your risk assessment. It shows that an explosion is your highest risk. And they said, oh, I never look at that column. Well, needless to say, that survey did not go particularly well for their emergency preparedness plan. So please use it as a tool. Take the results of it and modify your emergency preparedness plan. Modify the drills that you're planning for the next year based upon that. And there's a lot of different tools out there. The most common is the Kaiser Permanente hazard vulnerability analysis. We use a modified version of that at Ambulatory Healthcare Strategies. But so a big takeaway from here, especially the first quarter, is make sure you go through your HVA and make sure it's up to date and that you've used that HVA to change things within your emergency preparedness plan. Now, it is important to note that the regulation here says that you have to review and update it every 2 years. My recommendation is you're going to forget. I don't remember, what I did last week. But if you put this as part of your regular annual review of your policy and procedure manual, then you'll make sure that you're totally in compliance with this regulation.
Plus if something huge, like with the COVID thing, you wouldn't have wanted to skip over a year with that and not address it. And so we've kind of addressed this number 2, so I'll read it, but we've already talked about it for going back to the conditions for coverage. Emergency plan number 2 includes strategies for addressing emergency events identified by the risk assessment, so that we've just chatted about already.
Yeah, and I do want to add another example. So I remember in 2019, my director of operations and I were going through the way we were going to be reviewing all of the risk assessments for the next year. And we were going down the list of different items. And we came upon the issue of a pandemic. And I remember talking to my colleague there and saying, I don't think we need to spend a lot of time on that. I mean, what we're going to do is if a pandemic occurs, we're just going to say we're not going to, allow anybody to come to the center that shows any of the symptoms. Well, boy, did I learn a valuable lesson there that indeed a pandemic requires much more than just a couple lines in your emergency preparedness plan. So you're going to learn things as you go along, as you listen to podcasts, as you experience things in your organization, as you hear about other organizations in your community that experiences things. So definitely use your experiences as a way of modifying that plan.
And another point, places that would never flood, because they're not near water. But if you have a fire, even a small fire that doesn't do much damage, your sprinklers go on, you've just kind of flooded. So, you just never know.
Right. And Sue, to that point, we did an episode, 2 episodes ago, where we talked about water damage. Yeah. Flooding was one of the things we talked about, but there's other ways like, a burst pipe in your organization. We've seen humidifiers, for example, malfunctioning, which have caused massive floods. Organizations that live in multi-tenant buildings with different floors where an upper floor had flooded and affected your organization. So all of those things are things you have to address.
Okay, so moving on to number 3, address patient population, including but not limited to the types of services the ASC has the ability to provide in an emergency and continuity of operations, including delegations of authority and succession plans. And number 4, include a process for cooperation and collaboration with local, tribal, regional, state, and federal emergency preparedness officials' efforts to maintain an integrated response during a disaster or an emergency situation.
So I think the takeaway from 3 and 4 here is make sure that you're not using a canned emergency plan. Don't buy this from an outside organization unless they are working directly in your community. So as this regulation states, you have to make sure that it's based upon your situation, your patient population, the procedures that you're doing, where you're located, the type of economic situation you have, as well as the safety in your particular area. You have to address the issue of how do you continue operations. Many surgery centers really don't have the capability of operating reporting during a community-wide emergency. We just are not equipped for that sort of thing. Or maybe you are. Maybe you're in a building, or maybe you're part of a large organization that actually has a requirement to continue with that. And then you also have to look at your specific state and local situation. What is your emergency preparedness plan in your community? You need to know that, and you need to collaborate with your state and local officials who are involved in this. You actually have to send a letter to them saying, hey, here we are, we're a surgery center, these are the services we offer. We need to be part of the emergency plan in your community? Now, many times when you send that letter out, you're not going to get a response. Or if you do get a response, they'll say, thank you for telling us. There's nothing immediately that you need to do. So let's continue and talk about policies and procedures.
Back to the conditions for coverage, 416.54, emergency preparedness. B is policies and procedures. The ASC must develop and implement emergency preparedness policies and procedures based on the emergency plan set forth in paragraph A of the section, risk assessment at paragraph A1 of this section, and the communication plan at paragraph C of this section. The policies and procedures must be reviewed and updated at least every 2 years. At a minimum, the policies and procedures must address the following.
So I'm just going to talk through each of these requirements here in the plan, just so that rather than reading them and then talking about them later. So you need to have a system to track the location of on-duty staff and sheltered patients in the ASC's care during an emergency. And if any on-duty staff or sheltered patients have to be relocated during the emergency, the ASC must document the specific name and location of the receiving facility or other location. Now, I understand, that this is not something that's likely to happen, but you do have to address this in your emergency plan. And then you also have to address safe evacuation from the ASC, which includes the following. So you'd have to take consideration of the care and the treatment needs of the evacuees, the responsibilities of your staff, how you would transport the patients, identification of a specific evacuation location, make sure that your staff knows beforehand what that location is, and a primary and alternate means of communication with external sources of assistance. And that could be cell phones, could be wireless devices, etc. And then you also have to have a means of shelter in place for patients, staff, and volunteers who remain in the ASC. And then you also have to continue with your medical documentation. You have to have a system of medical documentation that does the following: preserves the patient information, protects the confidentiality of that patient information, and secures and maintains the availability of records. Keep in mind, during an emergency, your computer system, if you're using an electronic computer system, might not be available to you. So you still have to have some way of documenting that. So you should have some backup documentation. By the way, just parenthetically here, you really need to address as part of your emergency plan what to do if your EMR system goes down, and that's not infrequent.
Yeah.
And you shouldn't be, unless your plan is to stop operations at that point. But even if you stop operations, how are you going to document the patient that is currently in surgery right now or going through the process?
Yep.
So it's probably impossible for you to just say, I'm not going to continue on. You're going to have some backup paper that's readily available to you to be able to continue on with that documentation. And then continuing on to the requirements here, you have to address the use of volunteers in an emergency and other staffing strategies, including the process and role for integration of state and federally designated healthcare professionals to address surge needs during an emergency. Now, most of the time, what we find is ASCs are just going to say this is not an appropriate place for state and federal officials to come in and use, though it is possible. And then lastly, the role of the ASC under a waiver declared by the Secretary in accordance with Section 1135 of the Act in the provision of care and treatment at an alternative care site identified by emergency management officials. So this is a situation in which, working with the Secretary of Health and Human Services, an 1135 emergency has been declared, in which case you as a certified ambulatory surgery center might have some requirements to participate in the emergency plan that has been developed by your state or local officials. And then your communication plan also has to have name and contact information for the following people: your staff entities that provide services under arrangements, such as your fuel, for your generator, patients, physicians, and, of course, any volunteers. And then you also have to have confirmation for the following people: federal, state, tribal, regional, and local emergency preparedness staff, and any other sources of assistance. And then you also have to have a primary and alternate means of communicating with the following: your ASC staff, your federal, state, tribal, regional, and local emergency management agencies. And then you also have to have a method for sharing information and medical documentation for patients under the ASC's care, as appropriate with other healthcare providers, to maintain that continuity of care. And again, as we mentioned earlier, you might not have an EMR system, or you might not be able to print that information from your EMR system. So you need to develop some mechanism for providing that information to whoever you're sending your patients off to. You also have to have a means in the event of an evacuation to release patient information that's permitted under the HIPAA regulations. You have to have a means of providing information about the general condition and location of patients that were or are under the facility's care, and again, as permitted under HIPAA. And you also have to have a means of providing information about the ASC's needs and its ability to provide assistance to the authority having jurisdiction, the Incident Command Center, or the designee. So this could be CMS, could be your local Department of Health or your state Department of Health, as well as anybody else in your emergency preparedness centers in your local community. Moving on to training and testing. So one thing we should say, when we're talking about testing, we're actually talking about drills. And this is what the regulations state. The ASC must develop and maintain an emergency preparedness training and testing program that is based upon the emergency plan that's set forth earlier here, and that as well as addressing the issues in the risk assessment that we already talked about. Policies and procedures of this section, the communication plan, has to be integrated into the training and testing program. The training and testing program must be reviewed and updated at least every 2 years. And as I said, I really recommend that you do it annually, since you have to review your policy manual annually. Now, one point I want to make, and I know that I talk about this a lot, it's one of my pet peeves, but you have to be very careful about using canned emergency preparedness programs that you might be able to purchase from an online education provider. That will not meet the requirements of the conditions for coverage here.
And it won't help you in an actual emergency also.
That's right, because it's not going to talk about your specific emergencies in your community. Yeah. The things that you've identified as particular problem areas, particularly internal disaster. Remember, that has to address external disasters as well as internal disasters. And what, where your evacuation site is, all of those things are not going to be part of a generic training program. So this is something that you're going to have to specifically provide to your employees. Now, you might be able to upload this information into an online program, but that's a lot of work. In the end, it's usually easier just to have a meeting of your staff as part of your annual education program where you go through the emergency plan with them. It doesn't need to take a lot of time, but it does need to be something that's specifically tailored around your training program. And the training program requires the ASC to do the following. So you need to have initial training in emergency preparedness policy and procedures to all new and existing staff, individuals providing on-site services under arrangement, and volunteers consistent with their expected roles. Now, note when we're talking about this, that this is going to include your providers. So your anesthesia staff, your surgeons, anybody that comes into your organization, for example, vendors that are going to be in your operating room during procedures. They need to at least have some very basic information about emergency preparedness, so build that into your plan. Provide emergency preparedness training at least every 2 years. Now, again, I recommend you do this annually because it's easier to develop a plan that since so much of your training has to be provided, or ongoing training has to be provided annually, just make it a little bit easier on yourself so you don't have to remember which year you're in. You have to maintain documentation of all emergency preparedness training, and this has to include a list of all the people, usually signed-in sheets for all the people that have undergone that training. And you have to demonstrate staff knowledge of emergency procedures. So during a survey, for example, I'm going to be going up to your staff and I'm going to be asking them questions about the most recent training they had or what they would do under certain circumstances. And if the emergency preparedness policy and procedures are significantly updated, the ASC must conduct training on the updated policies and procedures. So if you change your policies and procedures between your annual or your regular training programs, you're going to have to update them on that.
And I think it's usually okay for the staff, as long as they've had training and can say general things, to say, well, they know where the emergency binder is. I would go grab that. I would turn to that. You're not supposed to have memorized every single step.
That's a very good point. And very important is that there's no way, I mean, fires, you're going to have to know immediately how to deal with that. Mm-hmm. But when it comes to, what would happen in the event of a tornado, if you're not expecting tornadoes in your area, that's likely they're going to have to go back to the emergency plan. So let's talk about testing. So this comes right out of the conditions for coverage. The ASC must conduct exercises to test the emergency plan at least annually, and the ASC must do the following. Now, of course, we're referring to the disaster drills here. They need to participate in a full-scale exercise that is community-based at least every 2 years, or when a community-based exercise is not accessible, conduct a facility-based functional exercise every 2 years, or if the ASC experiences an actual natural or man-made emergency that requires activation of the emergency plan, the ASC is exempt from engaging in the next required community-based or individual facility-based functional exercise following the onset of the emergency event. So there's a little bit of a nuance here. So
if you write it up, as you have to make sure you write it up.
That's
and
right.
Also because it really is, it's rare that the community will include ASCs in their community-wide drills. Really.
Yeah, and if you do, it probably wouldn't necessarily be very helpful to your organization, to your point. So most likely you're going to be doing a facility-based functional exercise. So Sue, what do we mean by functional exercise?
So you act it out. It can't just be a tabletop talking about it. You really want to go through the motions and learn something from it. Yeah,
you're going to be moving throughout the facility. You're going to be identifying areas. You're going to talk about how people would evacuate. Exactly. And I think, Sue, this is one of those weaknesses. Sometimes people stand around at the nurse's station, and that's not really a functional exercise. You actually have to carry out those things. Now, a tabletop exercise is an alternative.
Yes.
And we'll talk about that in a second. Now, you need to conduct an additional exercise at least every 2 years, opposite the year that the full-scale or functional exercise that we just talked about is conducted. And that may include, but is not limited to, the following. It could be another full-scale functional, community-based, or individual facility-based functional exercise, or a tabletop exercise or workshop that is led by a facilitator and includes a group discussion using a narrated, clinically relevant emergency scenario and a set of problem statements, directed messages, or prepared questions designed to challenge an emergency plan.
Because you really want the whole group to be involved. You want to talk it through, think through problems that might come up, rather than, I think some people kind of don't take it seriously and they just talk through, we'd do CPR, or, we'd, run out the door and go to our evacuation place. But you really have to talk through, what if this happens? What if that happens? Right. And really root out the problems that could happen, so you don't have to run into those in a real situation.
Yeah, I mean, well said. I think I actually like tabletop exercises in some ways more than the facility-based functional exercise, simply because you have an opportunity to sit down with everybody, walk through it. You kind of, if you're going to be a facilitator, first of all, I recommend that you hire an experienced facilitator. But if you're going to be a facilitator, you need to be able to engage everybody there, and which means asking questions of people that are somewhat quiet during that conversation. You really want to engage that, and you can learn a lot from a tabletop exercise, but it really has to be well designed well before you go into to doing the exercise. And then continuing on with the conditions for coverage, you need to analyze the ASC's response to and maintain documentation of all of those drills, tabletop exercises, and emergency events, and revise the ASC's emergency plan as needed. So, Sue, as you talked about, whether it is a drill or an actual event, you need to document it. Identify things that you've learned. Always identify the things that you've learned or changes that you've made to your plan. You will have an issue during a survey if the surveyor does not see a list of things that were learned during the drill and again, well documented. So one thing I want to do with today's discussion is kind of give you an action plan as you get to the end of this podcast. First of all, look at your risk assessment, pull it out, and add one 2024 event that, like a storm or a supply snag or one emerging threat such as cyber attacks, and review that plan, that revised plan, and that risk assessment with your governing body by the end of the month. Second, look at your policy. Skim your plan. If it's a generic, you need to make sure you're adding specifics to it, like who calls the hospital, where's the backup generator, how do you ration supplies, and then provide a fresh copy to your staff. Third, communication. Test your backup method this week. Call 3 staff off the paper list that you have for all the people that you have on your list. Meet with your local fire chief or EMS rep by April. Bring donuts if you have to. Build that bridge with your local emergency preparedness people. Training and testing. Schedule a tabletop drill, for example, for the quarter 2. Pick a tough one, say a cyber attack midday. Time it, critique it, and file the notes with your quality improvement records. And then lastly, documentation. Start a log. Note every tweak, test, or huddle that you have. Surveyors are just going to love that type of information if you provide it to them during a survey. So let's, in summary, just recognize emergency preparedness is very important. Surveyors are going to be looking for it, and this is a very common citation during surveys. And as I mentioned earlier, often as a surveyor, I find that hazard vulnerability analysis is just copied from the prior year. And by the way, sometimes I've seen HVAs that actually don't have a date on it, and the assumption I have is that it hasn't been updated. The emergency plan is often very brief or incomplete, particularly if you got it off the internet or purchased the plan. So make sure that you make it comprehensive and make sure that it definitely applies to your organization. And lastly, drills need to be well documented and real. So make sure that you have a very comprehensive drill documentation and include a list of all the people that have participated. And as I've mentioned, you have to include your providers. You have to include other, people that might be coming to your center. Everybody has to be part of the education program and those drills. So let's take a short break. When we come back, we'll talk about upcoming events in the ASC industry.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking engagements for John and his staff, and other events in the ASC industry.
So let's start by talking about accreditation organizations. Specifically, HHC has its Achieving Accreditation March 20th and 21st of this year at the Renaissance Orlando at SeaWorld in Orlando, Florida.
And the Joint Commission Ambulatory Care Conference is November 5th and 6th, 2025 at the Crowne Plaza, Chicago, O'Hare, in Rosemont, Illinois.
Moving on to other conferences going on, the Georgia and South Carolina ASC Association's semi-annual conference and trade show is March 20th and 21st in Atlanta, Georgia at the Renaissance Atlanta Waverly.
And the Florida Society of Ambulatory Surgical Centers Quality and Risk Management Conference is April 10th and 11th, 2025 at the Renaissance Tampa International Plaza Hotel.
And ASCA 2025 Conference and Expo is April 30th through May 3rd, 2025 at the Gaylord Rockies Resort and Convention Center in Denver, Colorado. And Ambulatory Healthcare Strategies will be there. I'll be speaking. Lori will be speaking at the conference. We're very excited about this. And by the way, Sue, I just heard that it is sold out already.
Yes.
And Sue, you've been working on something very exciting. We're going to actually have a booth there this year. So definitely, we'd love to have all of our listeners stop by, and we might have some giveaways at our booth at the conference. So
Ambulatory Healthcare Strategies booth.
That's right, the Ambulatory Healthcare Strategies booth.
And the Gulf States Conference is June 11th through the 13th, 2025 at the Ritz-Carlton, New Orleans.
And that includes Alabama, Louisiana, Mississippi, Ambulatory Surgery Centers. I think the 3 organizations in those states get together to do that conference. And the Florida Society of Ambulatory Surgical Centers annual conference and trade show is July 23rd through the 25th at the Hilton Orlando.
And the New York State ASC Association Conference will be held October 6th through the 8th at the Desmond in Albany, New York. And John will be speaking at the conference, and we'll do a special episode from there.
And as always, we have a huge presence. And if you are a client of Ambulatory Healthcare Strategies, mark your calendars because our annual New York State client meeting is going to be October 6th at the Desmond. And again, we'll also have a booth there. So definitely stop by and talk to us during that conference. And the Oregon ASC Association's annual conference will be October 9th and 10th, 2025. More information is to follow. I don't think it's actually listed on their website yet. And I will be speaking at the conference, and we'll do a special episode there.
The Washington Ambulatory Surgery Center Association's 2025 Annual Educational Conference and Trade Show is November 6th and 7th, 2025 at the Tulalip Resort and Spa in Tulalip, Washington. And John will be speaking at that conference, and we'll do a special episode from there, too.
That's right. And the Colorado ASC Association Conference will be held November 13th and 14th, 2025. And again, more information is going to follow on that. I don't think it's on the website either at this point. And I'll be speaking at the conference, and as we indicated, we're going to be doing a special episode. As soon as I look back on this list here, we're going to be traveling. I should say I will be traveling quite a bit and doing some special episodes. So we're very excited about that. And remember, on-demand versions of the ASC Director of Nursing, ASC Administrator, and the ASC Business Office Manager's bootcamps are available on our sister website at ASC-Central.com. And we'll provide a link in the show notes for you to get more information on that. And as we mentioned earlier in the podcast, we do want to remind everyone to become a patron member of the podcast. Don't miss out on all of those benefits of joining our program, which is available at ASC-Central.com, or you can go to ASCPodcast.com for a link. This comprehensive membership platform is your go-to resource for all aspects of ASC regulatory and accreditation, compliance, operations, and financial management. And it's designed with the busy schedules of administrators, nurse managers, and business office managers in mind. By becoming a member, you gain access to those regular Zoom sessions we talked about, those drop-in sessions, which are typically held on a weekly basis. And there you can engage with other patrons and the podcast team. But that's just the beginning. Your membership unlocks a wide range of resources, including access to virtual conferences such as our credentialing conference and conditions for coverage conference. And you also find valuable tools like sample policies, procedures forms, and fire and disaster drill kits. Your support helps us to maintain and grow the podcast, covering the essential costs like research, travel, equipment, and production. To learn more and become a member, as I mentioned, go to the ASCPodcast.com website or go to ASC-Central.com.
Thank you for tuning into this episode of the ASC Podcast with John Goehle. We hope you found the discussion insightful. If you did, please share it with your colleagues in the ASC community and be sure to subscribe so you never miss an episode. We appreciate your feedback and suggestions for future topics. Reach out anytime at comments@ascpodcast.com.
And a special thank you goes out to our incredible team here. Our sound editor, Sue, executive producer, John Goehle, and our committed research team of Sue Cronkite, Jenna Alvarez, Judy D'Ambrosio, Mike D'Ambrosio, Zach Caloritis, Jim Masters, Amy Cronkite, Lori Rodericks, Kathy Foti, Donna Macchio, and Christina Norman. Your hard work makes this podcast possible. Our theme music is by Media Sushi and Mike Noah, and the ASC Podcast with John Goehle is hosted on Podbean and may be found on all major podcast platforms. Thanks for listening, and we'll see you on the next episode.
This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, RFX Solutions, MedServ, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. RFX Solutions is your all-in-one healthcare regulatory compliance software. MedServ, which offers the only digital narcotics cabinet specifically designed and priced for surgery centers, helping develop standardized processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.